Bruxism. Now we are getting to where I want to be. I explained all this to reach this moment. Now, we talked about the disc. We talked about disc positioning. We discussed what a normal disc is, what a displaced disc is. There's the image. We talked about this joint space. We talked about having pain and not having pain. And now I'm going to reach the highlight of the lesson. Stages of sound. We are so concerned with occlusion, and we forget that our patient is sleeping poorly. We forget that every bruxist sleeps poorly. So we were taught to deal with the consequence of bruxism, which is dental wear, but we forget the most important thing. Why is this patient sleeping poorly? Why can't this patient reach the stages REM and not REM3, which are important for him for hormonal production, for the maintenance of homeostasis? So we go to technique courses. We do the best implants, the best implant courses, the best preparation courses. We learn to be minimally invasive, but we leave the patient sick, sleeping poorly, and with a beautiful veneer. But what will happen to this beautiful veneer? If he continues without ideal sleep, he will break this beautiful veneer. And if he continues without ideal sleep, no implant will last. So pay attention. Let's stop spinning our wheels in dentistry and understand that the mouth is part of a body and that this body needs to be healthy. And again, you who are with me until this point, I want to congratulate you, because you will understand that there are 4 stages of sleep and that bruxism generally occurs in stages 1 and 2, which are the light sleep stages. Stage 3, non-REM, and the REM stage are the stages where there is hormonal explosion, GH production, memory consolidation. All of this is essential for a child, for example, to grow, and for an adult to not develop Alzheimer's. So we are focused on technique courses while our patient sleeps poorly and no one is addressing it. But often we are in front of the patient's mouth. We are the first healthcare professional to have evidence. For example, a worn canine. The doctor cannot see that in a consultation, a general practitioner doctor. They cannot see that the canine is worn and that this may indicate the patient is sleeping poorly. They cannot see that. This is something wonderful about being a dentist. So we as dentists need to think 360 degrees, because we are faced with a huge opportunity to treat and control what harms our patient. And often we are neglecting this. So a complete sleep phase cycle, non-REM to REM, averages 1 hour and 50 minutes to 2 hours. Every 2 hours, do you cycle your sleep? And there is a latency between these sleep cycles. So considering an ideal average of 8 hours of sleep, that's 4 cycles. How many cycles do you complete? How many cycles does your patient complete? Can we achieve the necessary amount of deep sleep? And I know you might be thinking it's not much for me, but I want to tell you it's not, it's just unknown. So if you want to know more about these topics, start following me and share with more dentists.